do I know if my child has anxiety? Scared of the dark? Afraid of being left alone? Nervous about needles? Apprehensive about peer rejection? These are just some of the things children and adolescents report worrying about. We all experience worry from time to time, but if the worry is excessive, occurring most days for at least 6 months, and prevents your child from completing tasks or participating in activities, then you probably want to go ahead and watch this video. Hi and hello! Welcome to Nurturing Youth Counseling. I'm Colette, a licensed professional counselor partnering with you in your child's social and emotional development. I answer questions about children's mental health and provide skills that I've learned while in private practice and with my own children. Come journey along with me on this roller coaster ride of life that we call parenting. To understand if your child is clinically anxious, meaning the worry is debilitating enough that it stops your child from participating in living life, then you need to know how anxiety works. Remember, I said we're all anxious from time to time. That's because anxiety is a physiological response our body performs in order to survive. It's like an alarm system of sorts. Okay, imagine this. You're driving in your car down an icy road during winter, and your car starts to slide. Anxiety. Your prefrontal cortex sends an alert message to your amygdala telling yourself you're in danger. Your amygdala sends a message to your adrenal gland to pump out all that adrenaline. That way our heart starts beating faster, getting all the blood and oxygen to our muscles. Our pupils dilate so we can see better, and our digestion stops in its tracks because it's not a priority right now. In this moment, your anxiety is serving its purpose. It's having you react to your swerving car. But sometimes our worry gets a little haywire and makes us think we're in danger when we're really not. Our little amygdala gets confused and starts treating everything like an emergency when really it's just a false alarm. This is when worry starts impacting our daily living, making it clinical anxiety. When we have anxiety, we usually have physical symptoms, which is how our body is reacting to the anxiety, and behavioral symptoms, which is how we respond or what we do. The most common physical symptoms tend to be tummy aches, nausea, headaches, muscle aches, and sweating. But I've heard of people getting hives and rashes and diarrhea too, so anything goes. With the physical symptoms, I always recommend following up with a pediatrician to make sure there's nothing else going on before addressing the anxiety. The behavioral symptoms can vary more since children and adolescents react differently to their anxiety based on their age, development, and experiences. Some of the things to look for in children are crying, clinginess, tantrums and screaming, acting scared or upset, constantly worrying or having negative thoughts, finding it hard to concentrate, feeling tense and fidgety or using the toilet often, not sleeping or waking in the night with bad dreams, not eating properly, and refusing to do things. But you ask, aren't these things a normal part of child development? I would say yes. Most children become fearful when separated from their mothers, especially in unfamiliar surroundings. Fear of the dark or monsters is common in 3 to 4-year-olds. And shy children may initially react to new situations with fear or withdrawal. It's when the worry is debilitating and stops your child from participating or living life that would grab my attention. That's when I would recommend the additional support of a child therapist. In adolescence, anxiety is often overlooked because teenagers are really good at hiding their thoughts and feelings. Some things to look for in adolescence are recurring fears and worries about routine parts of everyday life, irritability, trouble concentrating, extreme self-consciousness or sensitivity to criticism, withdrawal from social activity, avoidance of difficult or new situations, drop in grades or school refusal, repeated reassurance seeking, sleep problems, and substance use. Some of this may be par for the course. We all know adolescence is a time of self-exploration and inserting independence. So how do you know if it's clinical anxiety or just a developmental blip on the radar? Well, older children and adolescents often become worried when a big project, like a book report or presentation, is due. This is a normal feeling given this situation. So what do? Do they proceed to give the report even though they're feeling anxious and worried? Or do they find a way to avoid it, whether intentionally or not, by refusing to do it or staying home sick? Remember, it's when the anxiety becomes debilitating enough that it stops your child from participating and living life that grabs my attention. If that's happening, I would recommend additional support through child therapy. I hope this was helpful for you. If so, please be sure to like, share, subscribe, and drop a comment below. Be sure to check out my previous videos if you're looking for a child therapist. And stay tuned for an upcoming video providing tips on how to help your anxious child. This video is not intended for legal advice or to replace mental health therapy. Also, I'm not a medical professional, so please seek the services of professionals if you're in need of them. As always, thank you for watching, and until next time, remember to breathe and enjoy this roller coaster ride of life that we call parenting.